Good morning. Thank you very much for following AU activities. His Excellency just left the meeting on a critical moment, so we will make it very, very short, and I will allow only 2 questions. So thank you, Excellency, for your presence. And directly I will give you the floor, please, to brief our journalist. Thank you.
Well, thank you very much, gentlemen. As usual, I'm very happy you're here to assist us, because that's the way I look at it. You send the information, and that's a lot of assistance. Now, what we are doing is the first STC, that Specialized Technical Committee on Health, Population, and Drug Control. Now, you know that this is now in the Constitutive Act that we are not having any sectorial ministerial meetings anymore. So the health section of the STC replaces the previous Conference of Ministers of Health. The population part of it, now we're going to have, instead of the previous African Population Commission, we're having this body now that's going to be an experts committee that will be looking at the population issues. Then you have the drug aspect. Now, the important part of this STC is that, one, we're finding a way, a common way, whereby we can look at the interlinkages between the three. The 3 issues of health, population, and drug control are related, but we are trying to explore the interrelationships between the 3. You know that health and population are significantly connected. Then, of course, the population and the question of the drug control and the use of drugs are also somehow related. So we're exploring the interlinkages. Then the second part of it is we want to see where health, population, and drug control can contribute to the present agenda items of the African Union, like the Common African Position and the Agenda 2063. How do these 3 reflect into the 2 major issues that Africa is looking at the moment? And then the third part is that this is 2015. We are transitioning to the Sustainable Development Goals. So we are looking at reviews of most of the instruments that we had before, like we're reviewing the MNCH reports, that's maternal, neonatal, and child health. We are reviewing the Africa Regional Nutrition Strategies. We are reviewing the roadmap, the African Union roadmap, for shared responsibility and global solidarity. We're even reviewing karma as well, which most of you know about. Then the 4th part, which comes as an emergency, is the issue of the African Center for Disease Control that is directly related to the Ebola outbreak and the preparedness, the emergency preparedness that Africa is trying to put in place for the future. So this basically is what the meeting is all about. I can go to a few details if you want to ask questions on that. Thank you.
Thank you, Commissioner. Colleagues, the floor is yours.
Well, the changes of this, changing to specialized technical committees, one, it's expensive to call 3 separate meetings of African Ministers of Health, Drug Control, and Population. It's very expensive holding meetings, but now we're putting them into one meeting. So that's one thing, we're saving money. And secondly, we're reducing the number of meetings, because now rather than having 3 meetings, we're having only 1. And thirdly, we think it's in the spirit of holistic approach to most problems, which we are finding out day after day. Dealing with the Ebola epidemic is better if we go with it using all the instruments we have, approaching it in a holistic kind of way. The issue of HIV, AIDS, TB, and malaria from the Abuja call also was approached better in a holistic kind of way. So is the issue of nutrition and definitely that of Ebola. So we think a new way of doing it is to bring everybody together and attack problems at the same time. So those are the reasons.
Thank you. The last question, please.
Well, Commissioner, earlier we've been talking about winning the fight against the Ebola viruses. Now that the African Union has crossed somehow the bridge itself, what is next for you? How are you really viewing the journey so far of fighting Ebola virus?
Well, let me answer that by first of all telling you the good news that we're actually on very good track. You know, almost every one of the three countries is making very, very significant progress, in particular Liberia, followed by Sierra Leone, where as of the week of the 5th of April, the whole country in something like a week recorded only about 9 cases. And the good news is those 9 cases are a follow-up to people that were being looked at. So which means actually no new cases came, it was those 9. Guinea made 21. So in the whole region, there were only 30 cases. Now, the good news about this is that we can now concentrate forces, you know, to areas that we need to pay more attention to. Now, going back to what you're saying, all of it is now a question of emergency preparedness, and that means strengthening the health institutions. All the meetings that you're looking at post-Ebola, they talk about strengthening the health institutions, putting instruments in place to make sure that we are not caught unawares again. An example of that being the African Center for Disease Control that we are talking about. People setting aside plans for global, an Ebola fund being established, the question of most probably a health corps, you know, being set up. But in the more immediate future, in January, Africa itself is going to hold an international Ebola meeting whereby we're going to be discussing all these things, and this will be in Malabo, 21st of July. You know, but almost every meeting that's been held by the African Union for the last year or so has a lot of emphasis on Ebola. And now, lately, is post-reconstruction of the countries economically, on health infrastructure, health institutions, as well as looking at their economies and helping them, you know, to recover from what they had lost over the last few years, or few months, I must say.
Thank you, Excellency. Thank you, dear colleagues. And let's meet after for other activities. Thank you very much.